So why SBA? This is just from the website, and again, the mission is to build a better and brighter future for all those impacted by spina bifida. I love working with the people at SBA. They're really making a difference without a lot of pomp and circumstance. They're very effective. They're creating and fostering the community. They're connecting researchers in the community, and they're connecting the community with researchers. They're getting the federal government to support our mission, and they're really doing it with relatively little money, but still doing great things. And some of the people I first worked with, Cindy Brownstein, who was the executive director, and now with Sarah for many years. The two on the right, Tim and Judy, they're so inspirational that they name awards for them. So what are some of the things SB's doing? They have a listserv, one for patients and one for providers. SB Connect, you can go on and it's got places for expectant parents, for parents of young children, for adults, and for healthcare professionals. SBU, it's an online educational tool that's by and for adults with spina bifida. The education days, we've participated in some of these and bringing subject experts to people all over the country. The chapters are doing it on a local level. It's not just about lobbying Congress for more money. You got to go to your state capital and lobby to make sure Medicaid in your state is doing the right thing. So they're doing that locally. They're connecting others and keeping the community going, and a lot of networking. The National Resource Center, Juanita's here somewhere. Can't see in the bright light, but she had 354 encounters last year. People have questions, and Juanita gets them an answer. The Collaborative Care Network, there are 38 partners of clinics really upping the care we deliver. Project ECHO we heard about, and that's working with transition from adolescence to self-care as adults. SB 101, I think this is just a brilliant idea that we're trying to change how spina bifida is taught to medical students and nursing students. The guidelines you've heard about, if you go to the guidelines, I don't expect you to read this, but you can see all the titles that are covered, and it's over 250 pages. The community, 50 years. This organization's been around 50 years and stronger than ever. It began as the Spina Bifida Association of America with just mostly chapters, but really has worked together to build a strong central organization. Walk and rolls are still held, and I was at a development committee meeting recently. We were talking about it's not just fundraising, it's friend-raising. I think that's a wonderful way of looking at it. But you know, raising almost $600,000 with like 8 or 10 walk and rolls is amazing. If you talk to fundraisers, the return on the investment is amazing. I was in Houston in November for something else, and I didn't have anything to do in the morning, and I noticed there was a walk and roll because I missed the one in North Carolina, and there's Kiki, who's one of the leaders around the country. And it's just, these are wonderful events, just the happiness and joy of the people you see there. This little butterfly was kind of the belle of the ball. So, you know, historically there was a national convention. The young adults with spina bifida looked forward to getting together and seeing their friends from all over the country, but we were basically preaching to the choir, what we were saying they'd heard the year before. So it was great for networking, but it really didn't advance care and research. But this is the 4th World Congress, and this is amazing, what we've evolved to. And just give a great hand to the organizers, because yesterday, the last 2 days, the level of science has been really top notch. I've heard a lot of comments how good it was, and as David said, the food has been excellent as well. So in terms of research, in addition to the World Congress, those guidelines identify the research gaps. There's not a lot of research I see in urology that says, they talk about what we know, but they don't talk about what we don't know, and I think that's so critical of advancing research. You saw a lot of the Professional Advisory Council up here, and then now we have the Research Advisory Council, and you also heard from the Centers for Disease Control. They're here and are motivated improve the care. And so you've heard a lot about the National Spina Bifida Patient Registry, so I won't go into it, except that it's amazing that there are over 11,000, I think it's 11,750 Americans enrolled in this, with 26 publications to date. The Umpire study you've heard about as well, and we now have 577 newborns that have been enrolled since birth. And we now have 5 publications to date. You've seen this map before. Talking about what part of the research community is just great people, I want to shout out to my mentor, Gordon Worley. I don't know if Gordon's still here, but he's a developmental pediatrician, and he's not a urologist, but he just inspired me for his level of research in spina bifida and was nice enough to take me with him to Washington when we started developing the National Spina Bifida Patient Registry. I love getting together with my friends. This is just a screenshot I did when we had a Zoom call working on the Umpire study with people from all over the country who I respect and love to work with. But I think what's really unique about Spina Bifida and SBA is that it's community-centered research, that we ask the people living with these issues, how can we improve your lives? That doesn't happen much in research. Usually we say, well, we're the doctors, we're going to tell you what we need to do. This is wonderful because we're having the community tell us what do we need to do to improve your lives. And I think you've heard this week, but again, bowel continence is the #1 concern, mental health, self-management, transition to being adult and independent, and urinary continence, and finally weight management. So I think it's just amazing this organization has a community tell us how we can improve lives. Advocacy, Teal on the Hill, you've heard about, and just some memories here. Mary Ellen and Jen and I went up to Washington, and it's really fun and it's really powerful to go into your congressional offices with your patients. This one was really interesting. This is not my congressman. He was down the road in Greensboro. But Mark Walker, the congressman, actually met with us. He really does look like he's off the set from Hollywood of what a congressman should look like. But he met with us and he told us that his sister died at age 2 of spina bifida growing up. I mean, that was a really powerful thing, and I think he was really an advocate for us. And going in with patients and families really moved him. Here we are in Senator Tillis's office. But just a lot of fun. Here we are, the North Carolina delegation. So if you have any passion about spina bifida, we need more money, go to Teal on the Hill. It's a lot of fun, and I think it's really upping the game. And last year, there were 80 meetings with legislative offices, and they actually got the House Appropriations Committee to increase funding for the National Spina Bifida Program. This year, there were over 70 meetings for 27 states, and we're working on increasing telehealth options. I can see patients by telehealth in Virginia now and South Carolina, but I can't in West Virginia. So so my patients from West Virginia still have to drive 5 hours to come see me. We need better coverage for equipment and supplies, not just for hospital care. So I think the Spina Bifida Association does great things. We can do even more with more money. SBA has really developed a multi-pronged approach to boost fundraising. I was talking to COO Mike Cook, and Mike's worked for many nonprofits whose names Americans have heard of a lot more than SBA, but he's never worked with one with such a clear mission and agenda. All the things I've been talking about, you don't need to, I mean, SBA, what we do is so clear and the benefits are so great, whereas a lot of nonprofits are like, let's get some money and we'll figure out what to do with it later. SBA has a plan, and he says it makes fundraising so much easier. The development director, Jenna Brown, has really upped the game, and we're already seeing the benefits of that. And the board and the development committee are really making big steps. So you'll probably be getting a lot more mailings, but encourage your friends. So the future, as I see it, is that we need to increase the awareness of spina bifida to the general public and medical community. We actually are having a big direct mailing that'll go to 300,000 people and I think that will increase spina bifida awareness, deliver better quality of care to people of all ages living with spina bifida, ensure that adults living with spina bifida have better education, resources, and medical care, give families access to information they need, even before their child is born. Not a lot of disease processes where we're actually doing education before it even happens. Increase the quantity and quality of research, guide research to address the needs of the spina bifida community, show the world that people living with spina bifida are thriving in an inclusive and equitable world, provide a vibrant and supportive community for all. So I think the future looks bright. This is a cartoon on a series that Courtney Sturr and I are working on with an illustrator from actually from Durham, North Carolina, but working on educational videos, and it's been a lot of fun. So to wrap up, why do I support SBA and why do I do research in the spina bifida realm? Well, again, going back to Martin Luther King Jr., no work is insignificant. All labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence. I think that really describes what SBA does. Thank you.